Okay. Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, good afternoon, good evening, wherever you are in the world. Thank you so much for joining us with Imam Abdurrahman bin Faisal with the webinar series under Chat and Talk. Thank you for our friends all over the world. We have people from India, from Pakistan, from America, and from different countries. Thank you so much. This is what we really mean by the international webinar. Imam Abdurrahman bin Faisal can speak to the world. Today, it's my privilege, really privilege to us to introduce two leading professors in medical education in the world. Within the topic today, I would like to have a video about Imam Abdurrahman bin Faisal in 2 minutes. And we would like to thank Professor Abdullah Rubeish, the president of Imam Abdurrahman bin Faisal University, is proud to announce our webinar, this series for enhancement of quality skills and education and leadership as well. Okay.
تمر جامعة الإمام عبد الرحمن بن فيصل بمرحلة ارتفعت فيها التوقعات، حيث يسهم التعليم في تقدم الأمم، ولذا تنطلق جامعتنا من رؤيتها الاستراتيجية جامعة رائدة تسعى إلى التميز محلياً وإقليمياً وعالمياً، وتهدف إلى تحقيق رسالتها على الوجه الأكمل في تقديم خدمات معرفية وبحثية ومهنية إبداعية بشراكة مجتمعية فاعلة، ومن خلال قيمها الأصيلة وعلى مدى تاريخنا العريق منذ أن تأسست عام 1975 ميلادي فرعاً من جامعة الملك فيصل بمدينة الدمام، مروراً بصدور القرار السامي لتحويلها إلى جامعة مستقلة عام 2009 تحت اسم جامعة الدمام، ثم انفصال جامعة حفر الباطن من رحم جامعة الدمام في عام 2014، وأخيراً بتشريفها بمسمى جامعة الإمام عبد الرحمن بن فيصل في عام 2016. كما تميزت الجامعة بالحصول على العديد من الاعتمادات المحلية والعالمية على مدى السنوات الماضية، ونحن فخورون بهذا الإنجاز والذي بني على خطط استراتيجية تجسد اختيارنا لنموذج الجامعة الشاملة أداة لتحقيق رسالتنا في خدمة الوطن عموماً والمنطقة الشرقية على وجه الخصوص. وينتشر منسوبون في 6 مواقع في المنطقة الشرقية، ويبلغ عدد موظفينا نحو 8000 موظف ما بين أعضاء هيئة التدريس والكادر الإداري والطبي. كما يدرس في الجامعة ما مجموعه 35,000 من الطلبة ينتشرون في 19 كلية و85 برنامجا ضمن 4 قطاعات طبية وهندسية وإدارية علمية وإنسانية ومصنفة كالتالي: المسار الصحي، كلية الطب، كلية طب الأسنان، كلية الصيدلة الإكلينيكية، كلية العلوم الطبية التطبيقية بالدمام، كلية التمريض، كلية الصحة العامة، كلية العلوم الطبية التطبيقية بالجبيل. المسار الهندسي، كلية الهندسة، كلية العمارة والتخطيط، كلية التصاميم. المسار العلمي: كلية علوم الحاسب وتقنية المعلومات، كلية إدارة الأعمال، كلية العلوم، كلية العلوم والدراسات الإنسانية بالجبيل. المسار الإنساني: كلية الآداب، كلية التربية، كلية العلوم والدراسات الإنسانية بالجبيل. كليات لا تتبع السنة التحضيرية: كلية الدراسات التطبيقية وخدمة المجتمع، كلية الشريعة والقانون، وكلية المجتمع.
Thank you so much. I just would like to highlight about Jasur initiative, where we are today hosting the webinar, which aims to be connecting to the world and connecting to our friends all over the world. And we are through the webinar and Zoom webinar. We will have more than an issues to be discussed monthly, and we'll announce it one by one, and I think we need to follow, and also we're going to send by email for all our registered the next of webinars. Today, the Medical College of the Future, from informative to transformative. This is the title of the webinar, and the objectives, and the speaker is going to focus on major forms and disruptive forces of change in healthcare and system innovation. They're going to focus the implication of these changes on the transformation of medical education for the future. Also, features of medical education in the future and who should lead the transformation. It's my pleasure, honestly, to introduce our Goras in medical education, Professor Hussam Hamdi. We learn from his paper. We learn from him a lot of things. It's been years of leading the medical education and different colleges and different universities. He's a professor of surgery and medical education, an internationally known medical educator and active pediatric surgeon, a scholar, professional, and leader in higher education in the Middle East, and renowned internationally. Professor Sam is the first recipient of the Health Worker Recognition Award of the category of medical education. Congratulations, Dr. Hussam. This is recently announced by the WHO president. He has established, contributed, and led several medical colleges, such as Swiss Canal University in Egypt, Arabian Gulf University in Bahrain, Gulf Medical University in UAE. He has served in different senior academic and administrative positions as a chancellor, Gulf Medical University, Vice Chancellor, Medical and Health Science College, Sharjah University, Director of Institute of Leadership, and as a matter of fact, he's the one established it in Sharjah, and the Dean College of Medicine for years in Arabian Gulf University in Bahrain. I would like to really to welcome our Professor Hussam Hamdi. The other speaker, he's my teacher. I cannot, say a lot of things. He is Professor Fahad Al-Muhanna. He's really the godfathers for medical education in Saudi Arabia. If we remember back in 1990s, 1994, when he started a lot of initiative in that time, and experience in college as academician for 35 years, and the dean of the College of Medicine at King Faisal University, and Imam Abdurrahman bin Faisal for more than 10 years. Experience in healthcare executive, as a general supervisor also for more than 10 years in King Fahd Hospital University. Also, on the other hand, he has a lot of experience in medical education, and also as a nephrologist, in internal medicine as a specialty, and as a consultant. Also, he has a special interest and expertise in the healthcare system. He was a CEO of King Fahd Special Hospital in Dammam and board member for KFMC in Riyadh and other private hospitals in Saudi Arabia and all over the world as well, as far as I know, even in the Gulf. Worked as a special advisor to Hamad Al-Mani, and that's the previous minister health in Saudi Arabia between 2005-2008, with experience in teaching, research as healthcare provider at the College of Medicine, distinguished record of publication, academic journal, committed to help the student in order to develop their full potential in their studies, strong philosophy of teaching and knowledgeable of many different methods to motivate a student. And I would like also to congratulate Dr. Fahd for his publishing a new book now about industrial university. It will be in the market soon. And this is really one of the books we find a lot of experience of academician, they can have it. Dedicated member to university program that help and promote learning and support the community. Commissioned the teaching and operation King Fahd Hospital in Dammam during the period of work for Eastern Province Saudi Arabia, consultation to provide different government and agencies. Now he is the advisor for the president for Imam Abdurrahman bin Faisal in commissioning, teaching and operating the new university hospital. I think he's a strong believer of professionalism and humanism. I just want to touch the topic as long as I discuss the objective and the overview of the topic. Dr. Hussam, Professor Hussam and Professor Hamdi, they will speak about the changes that will continue, that will be as a continuous repetition between evaluation and evaluation, medicine and, as a report public, medical college of the future should be developed in the light of social constructivism theories, and I think we need to hear from the speakers about it. We're going to have the disruptive forces change as well, especially COVID. In academic healthcare system, also we're going to listen from Dr. Fahd, couple knowledge and couple information and their experience and training of a student, public or private, student who want to, as a future physician, and how they exposed to how researchers think. For the last, I think the history of the future of medicine, it will be touched as well, and it will be linked with the from the title itself, from the formative to the transformative. I don't want to speak more. I think we are all of us eager to listen to Professor Hussam Hamdi. He will start his PowerPoint and his speech. Then we're going to have Professor Fahd Al-Muhanna. Professor Hussam, you are more than welcome. The floor is yours, sir.
Thank you very much, Professor Ahmed. And first, I would like to thank the Imam Abdurrahman bin Faisal University and His Excellency Professor Abdullah Rubeish, the president of the university, for inviting me to contribute to this series of webinar which the university has been leading it. Let me say also that I was very pleased that my very dear friend, Professor Fahd Al-Muhanna, that we are together in this webinar, because you are going to see we really complement each other, and he is a vivid model of the integration between academia and healthcare, which is one of the issues which I'm going to raise it in my presentation. I think the objectives has been presented by Dr. Ahmed. Just to remind you about it, I would like to talk about the major reforms and the disruptive forces leading to the change in healthcare and health system innovation, and the implication of these changes on the transformation of medical education for the future, and what could be some of the feature of medical college for the future. And at last and not least, but very important, who is going to lead this transformation? So maybe my first thing is a bit philosophical, but the French philosopher Alain Badiou, he described an event that it has the power to rupture standard practices and approved knowledge, disclosing heightened ability to think and act. And this can be at an individual level in the life of any one of us. It could be for the whole country, an event, or the whole world, like COVID. COVID is an event which has influenced the whole world, and it has disrupted everything we are doing and generating new knowledge and new ways of doing things. And one of them is education. And I think February 2020 is a point of no return to the educational system of the past. No return. So we have to be ready that things are changing and will change and will continue to change. And I'm taking a position which I would like to share it with you at the beginning of this webinar. My argument is that health professionals' education programs, they are about people, societies, and human interaction, but embedded in a rapidly changing social and work-related systems. So the human being and the work-related system and the interaction between them. At the same time, the ecosystem of medical education is definitely inseparable from the healthcare systems of the country, its economic, political, social, and cultural systems. We are in the center, surrounded by all these systems around us, and interacting, influencing them, and being influenced by them. So this is very important. Medical college or medical education, it doesn't work in isolation within the wall of a university only. It's much, much more than that. So the complexity of this medical education is, as I'm saying, is not only about technology, which is changing every day, every minute. It is not only about a new curriculum design or about how to teach and where to teach and what to teach, but it is more about this complex relation between medical education and the healthcare systems. Our friends in the business world, they call it the wicked problem. And you can see, I describe it sometimes as a spaghetti problem, because you cannot solve it in a linear fashion. It is very complex, the wicked problem. You can Google it and learn more about it. Very interesting concept. So what are some of these disruptive forces? Definitely a huge advance in the medical knowledge, sciences, and practice, how things are done. The technology, new technology for diagnosis and treatment, from using AI to robotic. The fast changing demographics around us, the elderly, the chronic diseases, the life expectancy, the healthy life expectancy, and so on. And very important, now your patients are coming to you and they are better educated. They have Googled their problem and they have Googled us, the treating physician. And then the whole area of big data analytics and informatics. All this now, we work with huge number of data, which help us in taking decisions. Of course, COVID-19 is one of these huge disruptive forces. And the global health, look at what happens in one part of the world, it affects the whole world. So I call it the domino effect. So we are not in isolation. That's why global health is very important to understand it. Another important concept is the changing model of practice. Now, it is not based on one doctor who is looking after the patient. Now we are working or moving more and more toward team-based model of care and education. That's why we promote now the importance of interprofessional education, what I call it learning together, in order to work together. That's the practice part. So the learning part should lead to the practice part. And it is too late if you start after graduation as a doctor, as a nurse, as a physiotherapist, to tell them that you have to work together. This has to be embedded very early, from year one, actually, in medical schools and in medical universities. Now, the new sites of care, we were used to a hospital-based type of care, maybe with some ambulatory or community-based, but now we are moving into more and more towards home care and telemedicine. I don't now need to go to the primary health care to get my treatment. I take an appointment and I call the doctor and we have a chat together. And if it is needed, I will go to the hospital or to the healthcare center. So things gradually will change. Another issue, which is very important, perhaps Dr. Mehanna is going to talk about it, is financing the healthcare system. Now we are shifting from volume of patients, we see them in the hospital, or you come and say, all the beds are full. No, we are moving now more toward the value-based healthcare, and value equal quality divided by the cost. It's a new concept which will influence insurance and everything, which we are doing it now. The very important change which is happening and will continue to happen is the development of academic healthcare systems. And Medical Education Institute, as an education system, will integrate or should integrate more with the healthcare systems, transforming it and developing it into academic healthcare system or centers. And this will be the norm, not the exception, in the private sector and in the government sector. And we, instead of working as two individual pillars, the academia and healthcare, different levels of integration will take place, gradually reaching till some sort of important integration. Of course, you have to remember that one of the main obstacles in that is the organizational culture change, which has to take place, and good leadership. But this is where we are going now. So the public-private partnership will be more, it will spread and become more regulated and encouraged. So the public alone cannot work in isolation of the private. I think the private healthcare will be much more than the public. Of course, there will be insurance and so on. And the training of students will be in all healthcare related facilities in the community. Again, public and private. So these are very important changes which are happening at present. Now, let's move to some more education. So are we going to have new curriculum? I think so. But one size doesn't fit all, because everything is context dependent. And we cannot imagine that there is one best type of curriculum which can be applied to all medical colleges globally. You will find curriculum 4+4, 2+4, 1+5, 5, 2+2. It reminds me sometimes of football when they say 4-4 and so on. So this is not very important. What is important, what we have to differentiate actually in this new curriculum, between the tools which we are using it, the knowledge and skill for practice in the field of study for a profession, because it's not limited to medicine only, and the societal needs and the impact, fitness for purpose of the graduate. So the quality of the program is more important than only number of years or number of credit, which I'm going to talk about it later. You all are moving, and we are also moving from more towards competency-based education. We are moving from course-based, what the graduate knows, accumulating credits, towards more competency-based, fitness for purpose, what the graduate is able to do. And if you look at the different competency frameworks, the Canadian CanMed or the ACJME in UK, in US, or GMC, or the Saudi competency domains and standards, and others, you'll find they are saying almost the same thing as domains. And competencies overlap. And we are not talking about how is the system and how the team and how we are going to do that and how we are going to teach it or introduce it or assess it. There are still a lot of challenging issues related to competency-based education. Now, in many curricula, you will find that still what I call the 2 pillars curriculum, that you have basic science for 2-3 years, followed by clinical sciences for 2 to 3 years, where there is no integration or some sort of integration, but this system is more than 100 years old. We have moved about 40 years ago to more an integrated curriculum between basic medical sciences and clinical sciences, using different strategies of teaching and learning like PBL and TBL and so on. But still the wall between the two systems, the two sciences, is still rigid. And now we are moving more towards a system which is based on a very important theory, the community of practice theory, that you embed the learner in the tribe, and learning will take place, of course, guided and so on. We have started moving into more what I call it the fusional model. You break the wall between clinical sciences and you take the learning into the hospital, even in the pre-clinical phase. And this, you can imagine teaching basic science in the hospital, the clinical physiology, the radiology, the imaging, and so on. And now we are moving and perhaps pushing towards what I call it the 4 pillars model, because there are new pillars which are coming up, apart from the basic medical science, clinical science. Now, systems and social sciences are very important. Research and innovation is one of the very important pillars, leading to competencies and even another level higher than that, which is the intrastability. Cutting across all this technology and data sciences. So this is a model. We are working around it at present, and I think gradually it will, many places will be using something like this or modification of this type of models. The students are different. The new students are tech natives, the interprofessional education and practice, so they are learning together. Students from year one are exposed to the workplace. And as I mentioned, research and innovation will be integrated into all the students' learning experience. There will be new faculty. The new faculty, they are not anymore information giver. They are facilitator of learning. They are more role models. They are experts and innovators. Colleges and universities will start to develop more faculty track systems, educational track, research track, clinical track, what I call it, the 80-20 model, which will vary between each track. Faculty workload, which you are all familiar with it, will be redefined. There will be role-based model of workload. We'll be moving from the teaching load, traditional teaching load, to more towards the educational load. The new knowledge, which we have to introduce it in our curriculum. Now we are talking about precision medicine, more genetics, molecular medicine, AI and machine learning, data sciences, global health and health economics, leadership, management and entrepreneurship, social determinant of health and disease, healthcare systems. So all these are very important new content, new knowledge, how to introduce it and how to assess it. This is a challenge at present. We should be sharing curriculum content. Now, this is a model which we are using it, sharing it with many universities, Brown University, University of Buffalo, and it's what's called the Scholar X. It's form of interactive learning units, particularly in the basic science, which we share it. You can contextualize it, you can modify it, you can add to it, but you don't have to invent the wheel, and you can provide your faculty and students with high quality modules like this one with an assessment and learning system with explanation. So we are sharing the experiences together from all over the world. This is a new concept of sharing. I imagine that the university will also change their organization. If we are talking about themes, there will be something new types of departments based on this integration, like the one I'm explaining here. Maybe there will be a department of ethics and professionalism, or research and innovation, healthcare systems and economics. So a new structure of the university and of its colleges. The new technology, you are all living now all this new technology which is taking place. And there is a major paradigm shift, AI and machine learning, robotics, analytics, data analysis, informatics. All these are new technology coming in the medical schools. We are now developing a vertical theme in our curriculum called technology and data sciences, and it has 3 levels. The first level, an introductory courses, and we can go to level 2, developing and understanding some algorithms, basic programming, data analytics, machine learning, moving towards health informatics, healthcare management, hospital management systems, and so on. This is a world where our graduates will be working in it. So we have to prepare them for that. So the educational environment is changing. The learning environment will change. Learning is not now in big lecture halls. It takes place everywhere. The library is changing. It's more like a Starbucks, 24 hours, 7 days a week, access to the information and to the e-learning, wherever they are. So even the furniture in the classroom will change. We are using here artificial intelligence. We have developed what's called DPL, which is an online simulation system developed at Gulf Medical University, where learners plays a role of a physician who confronts an authentic simulated patient, a real human being.
Good morning, doctor.
So they interact with this patient and they ask him questions and he answers.
I feel tired and fatigued. It's true my job is stressful and I work long hours, but I've been doing this type of work for 20 years now.
And they keep asking him, and then they measure his blood pressure, they look to his investigation and so on. So this is a new way of teaching. We are developing new assessment systems, measuring outcome competencies at different levels of the student progression, measuring competencies at the intrustable level. Because the community will ask, can I trust him or her? They don't care if they obtained an A or a B or an A+, but it's a trust. So we are moving towards more trust-based education. So the new assessment system, we are sharing together also question bank, and we need to do more in this direction. And this takes us to measuring the competency at different levels, as I mentioned, the programmatic assessment, which our friend Kees van der Vleuten has been promoting it, and it's a wonderful system. We can use even artificial intelligence in assessment of like what we did here. You can read this paper on virtual clinical encounter examination. Portfolio will be a very important tool to collect all this data and to evaluate the students based on the portfolio. So electronic portfolios capturing what the student is able to do and what he's actually did is much more than important and valuable and valid than MCQs exam. So now I go to a sensitive area, which is a quality assurance, because we are used more to time-based education, which will be replaced, as I said, by trust-based education. The credit hour system, which is everywhere, is a system developed from the 19th century, but it cannot still be used in the 21st century. We should come and look into different systems of measurement of quality of education. The metrics needs to be revisited, and I'm going to invite you all to a conference which will take place in next February in UAE here. I hope you can attend it. So accreditation bodies should adapt to these changes and lead the transformation, moving from towards transformative quality assurance systems. I believe accreditation bodies will play a very important role in this transformation. We need visionary, transformative leadership who will lead this transformation. It's not easy, a lot of resistance, but if the vision is clear, the good leaders will be able to take us there. At last, can I predict the future? Very difficult. But the only thing perhaps which we can predict with confidence is that for the coming few decades, the patient is still human, the doctor is human, and the medical student is human. What will change is how they communicate, interact with, and understand each other, not only at individual levels, but at the system levels and globally. I totally believe that medicine is a social science. Thank you very much.
Thank you. Thank you, Professor Hussam. I really appreciate it. I think we have a take home now with this prediction from your side. Now it's the time really to listen to Professor Fahad Al-Muhanna. I think chat and talk, Dr. Professor Fahad, he has a lot to say about the healthcare system and medical education within the 4 objectives. Professor Fahad, the floor is yours.
Thank you, Dr. Ahmed. Can you listen?
Yes, yes, yes. We listen to you, and we can move the slide as well.
Okay, thank you, Dr. Ahmed. I'd like really to thank everybody who was under, this preparing for this webinar. And I'm so pleased really to be invited, and especially to share Professor Hamdi and to learn from him. He's my teachers, he was my mentors, and also I learned during, working together a lot from him as a leader of the education. That's why he deserved to be awarded and recognized to be, one of the health workers recognized award by WHO. Dr. Hamdi, congratulate you and also for ourselves. Second, I will take you a little bit mixing some of those thoughts Dr. Hamdi said, but also I'd like really to concentrate about some of the past, and from the past we can just predict and anticipate what is, future. We talk about the informative, Dr. Hamdi talk about the transformative, but we need really to talk about the metaformatives as part of the metacognitive things that we are talking and we are facing nowadays. Beyond doubt that the health system is having different from, the academic medical system, but they are shared together. And that's why some of our groups or some our countries like Israel, like, Iran, they put together the health system and medical education and health professional education together. So they built, a better quality. And this is where taken from Alberto Ferreri, the gentleman who put, the breast educations from Brazil, and they just continue that thought since that time. I think, the medical education and the health professional education and the academic medicine, when they put together, really they can put under the umbrella either what Professor Hamdi give it, as healthcare academic system or academic medical system. They are the same, and the health system is contributing to the same function, but with a different dimension, because the component of the health system, as by definition of the WHO, we need to plan, organize, finance, and this is the most important nowadays, is how to finance and how to invest in our healthcare system. And this, direction is nowadays taken in United Arab Emirates, and Saudi Arabia. And all these should be based on the health need and based on the capacity and demand assessment of the community that we will talk about, and how to prepare the good workforce and human capital that already Dr. Hamdi talked about, and during talking about the medical college. And we need really to have an evaluation and a feedback system that can help us in developing a better system rather than just stand still. Technology adaptation is one of the most important part in health system, but need not to forget that there is a different health system internationally, and each countries of our, Middle East countries have different approach. There is the beverage types of healthcare that adapted by England and UK, the Bismarckian that adapted by Germany, and the government insurance-based system that adapted by Japan, Singapore, and Korea. We have the private insurance-based healthcare system, which is adapted by United States, and also we have the hybrid, where they are mixing all these and they get the benefit of all, and sometimes they get, the mistake of all, like what we are having in Saudi Arabia. This is beyond doubt will have criteria. When you have the health system, what are the criteria that you provide very comprehensive with universal coverage, with a good response to the community health needs, and to provide the services with justice, fairness, being acceptable, affordable. When it's come to the patient directly, it should be, quality oriented with a steep, terminology which indicates safety, time, effectiveness, equity, etc. But these types of health system where it responds to the health need, it can be given as an example, the response of our healthcare system in GCC country toward, the COVID-19, where we were looking for the preparedness and readiness of the people and of the system. If we are talking about the community needs and the population needs, so that we can just predict what type of, medical college or health professional college we need to split. As Dr. Hamdi, medicine is a social science. So we need to split what type of categories that we are having in our communities. Our needs depend on what level of health that we are having. We will find 40% of our population, they are, in a good health, but they are looking for well-being. And well-being, يسمونها الرفاه. And this is, they are 40% of people, they can be, just served by, an extra services by a private, especially the private, where they can provide all these fitness, etc., etc. Another 50%, another 40% of our populations, we are there healthy, but unfortunately, they are at risk either from the environment or they are at risk because there is a genetic background to be, and to be diseased. So they can be transferred to the other groups. And these people, we need to provide them with the protections and with the promotion that can be also served in the community. The least one, which is 20% of our population, they are sick and they need, a direct health care. Out of those 50%, which is equal to 10%, they have chronic disease, and some of those, diseases need to be care at home or palliative types of care. And the other 50% that we are having, which is 10%, they have an acute or critical or, pre-hospital care needed because it's life and death. And they are example of that, the road traffic accident. And this is, part of what, the people who wrote about the transitional epidemiological theories, they mentioned that we need really to go back and review such. Those hospitals, as you can see in the slide, they can be a general hospital or a specialty, or they can be a long-term if they are, part of the chronic care. All these together, it will give us, the country needs. And from that, we can see, we can build up what type of workforces that we need really to produce, or we need to have the outcome of our universities, especially the medical school, and we need to have to develop our human capital. And from that, we need to have a KPI for our hospitals and our community health services. And this KPI examples in the hospitals is, load indicators, performance indicator, cost indicators, and health technology indicator. That's why the people's and health economics, when they review it, they found it is very expensive and they need to have a value-based hospital. And that's the development of value-based hospital, and it's now becoming international recognized. The first people who talk about it, the Boston consulting groups, and they developed from that the criteria that Professor Hamdi mentioned, which is, the 3 P's criteria, private-public partnership. When we talk about the community, which it's, as Dr. Hamdi said, that there is a lot of demographic changes and that we need to have the demographic indicators. And we need to look, at least in Saudi Arabia, from my personal view, that we need to look to each area or each province because they have different community and different geography, different demography. So we need to look for all these because our need is different, and they are, a part of what they call it pull and push mooring phenomena or theories, where some of them will be pushed out, some of them will be pulled out, especially with the changing in the economics nowadays happening. And also we need not to forget that also we need to have the other, which is, protection and motivation theories or phenomena that will happen to our people in the community so that we adjust our healthcare system needs and we look for our hospital needs, which is, some of those load indicator, everybody working in the hospital, they knows what are they, but just I show them for everybody that it's an important to know, because from this indicator, we can assess our, economies, our costs and values, and we can say, yes, we do need to have more hospital or we need to take out such, services. When we talk, about the performance is part of really, of how I'm going really to predict the needs of, when I talk about, the average length of stay, this will calculate the money. And if I am calculating money, this means I need really to have, capital, human capital to serve that group of services so that I can produce a continuity, a sustainable services. So it's good really to look, for the performance indicator and look for the cost analysis, which is the next slide. Next slide was cost indicators, where these are very important in assessing, our productivity and if we are achieving. And if we just look, to Vision 2030 in Saudi Arabia, where there is, there was transformation 2020, even though it was a little bit delayed, but it was really trying to achieve. And they now transfer it from being Ministry of Health only to be all health sectors transformation program, because this will be based on the economy rather than, the willingness and demand of the population. Health technology indicators is a subject of debate, but it's really to be considered. It's not, the less important. It might be very important, or it might be the most important, but this will be discussed in correlation to the change of the human being. The next is when we look, the other, KPI that I'm mentioning is I leave it, for the people who is taking care of that, but we need to correlate what I said to the type of healthcare that Saudi Arabia is adapting. And if you see this, where, started in 2018, you can see we have a different layering of health system that Professor Hamdi mentioning, but the most important of all is that to have a physical health, to have a mental health, to have a social health. And that's why he's insisting that medicine is a social science, but I need really to add the spiritual health being, an area where we believe of a spirituality. And this can be added, even it's not added here in this chart. But with all this, we can get, all types of services, including the end-of-life services. We can get, the chronic care services, the urgent care services, the maternity care services, and, the other services that we need really to look for, including the virtual services. That's why Dr. Hamdi mentioning during his talk that I don't need really go back to the primary healthcare, because I can have my services home delivery. Nowadays, in our hospitals, during the COVID, we are asking our people through our virtual system, and we prescribe the medication, especially we are as a nephrologist, we know that they need a lot of, refill. So we evaluate them, then we just send our medications and recommendation through, logistic to them home as a home delivery. So we need really to look for all this. But today our talk is about how we can build such services without workforce. Who will provide us with the workforce is the health professional colleges and medical colleges. So we go to the next slide, where we are going to talk about, how does our health medical or health professional colleges and our medical colleges work together with the hospitals to create a medical or academic medical system with the triad, which is the provide the health services, keep research, and build a development and develop a human capability and talent. And this is the most important part of and function of the academic medical system. Based on that, and as Professor Hamdi, I'm referring back to what he said and value-based hospital, and what we are encountering nowadays in our hospital, in our country, that people look how much we save and how much we are efficient in the cost, i.e., I need to have a value to whatever I'm asking for, because it's not only asking the money, then people do. And the what they call it, cost saving efficiency authority, هيئة كفاءة الإنفاق, they are recommending the following: that primary care health services need to be reconsidered in accordance to the health professional needs. Secondary care services, which include the general hospital, which is also called the community maternity hospital, pediatric hospital, and mental hospital or psychiatry hospital, is a priority, like the primary care services, but they can mix together and they can provide also the virtual services. So next slide. The tertiary or specialty, there are many, and you can see them, and also we can develop quaternary care services within the tertiary services, but we need not to forget a big numbers of people, especially with the changing health pyramids or population pyramids. In Saudi Arabia, that's what's happening in North Europe. We need to have an extended care services, which we calculated recently in Eastern Province that it might need more than 1,200 beds. Next slide. Based on that, and we need really to see, what are the things that we are providing. Dr. Hamdi elaborates so much in that, and I cannot really, combine with him in his way and his capability to tell people what he needs. But I can tell you that we need to have knowledge, skill, and attitude, and these are based on a lot of theoretical or learning theories, and most of it is becoming theoretical, but we need to transform these theories into practical things. We need to construct that based on Mizero theories and learning. If I construct that experience or that knowledge to a real experience that he can practice, and he become a professional, that's what we need. And the best place for them to do it is, the academic medical services or academic hospitals or teaching hospital or whatever. I'm not talking about university that owned by the university, any hospital, even the private, as Professor Hamdi said, they can be an excellent teaching hospital when they can give the knowledge, the practical, the communication skill, the teamwork, and the professional skills. With all of that, the soft skill will be a better built up. So do we need to put, strategic objective and strategic direction for our workforce? Yes, we do need to have that. But before I go to that, I should bring you back to the history. This is a book by Dr. Abdurrahman Naqib, and I think it's a good book about how to prepare, our physician and all Islamic literatures, why we cannot move very fast, and I'll show you the public policies from the politician and from the others, which indicate the bureaucracy that we are having, and another forces that we need to respect and we need to take care of is the generation which is, changing the world, either in state or Canada or Australia, or even in Arabs with what they call it, the Arab Spring 2011. And then we need really to think about that through what, reality and the market. We are market-based rather. In the past, you can see this is a group of slides to tell you the knowledge is kept changing. We need not to stick to the knowledge, because if I told you about this as, professional, they think that I am stupid. But just to show you, the stupidity sometimes is good, as Einstein said. Show, the next slide to continue the stupidity. And this is part of the stupidity. Another one, next slide. Then tell the gentleman, Flexner, when he came in 1910, he said, let's rearrange, how we are going to give the education. And he put, his declaration. Then different peoples, they make another declaration. Edinburgh 2013, the last that I know, Bologna 2004, and there was some recommendation just recently in EMA, and these are all need to be really considered. And we have, an authority with us. He can also provide us with what is other recommendation that he can, other than what he mentioned, the need to think about the future medical school. Next, please. So if we are talking about the future of medical education and the future of health professional education, we need to look for, the types of peoples, the expert peoples that knows the situation and the sociology and the anthropology. Most of the time, we forget, the sociology, and that's medicine is social science, and we forget, the anthropology, which is part of it, science and art and philosophy. Next, please. So when we talk about such, things, when we talk about, we need to define, what do we mean by medical education? Dr. Hamdi, he knows the one gentleman that I'm mentioning, his name, Dr. Zuhair Nu'man, alayhi rahmatullah. He make very simple definition of medical education, and he just put it, it's an art and science of producing a safe physician, but that safe physician need to be within a special characteristic that to be kept with him. He need to be human, he need to be a professional with professionalism, and he need to have financialism, i.e. he knows what is the cost. Those people who was trained in UK, they knows very well during 80s and 90s, BNF should be with us as a physician to know what is the cost of the medication of amoxicillin that I'm going to prescribe. Otherwise, your teachers or your professor, he will not be happy with you. So financialism is an important, and need to standardize a way of teaching, and we need to have an authority to make an accreditation like WFMA, World Federation of Medical Education, because they are keep the standard. They are can share knowledge with us. And as you know, WFMA now giving an accreditation to the local accredited area or authorities like NCAA in Saudi Arabia, and those things only done in academic medical system. I'm not talking about the hospital, is it with X or Y? It's, the system that have a special, accreditation standard, i.e. the standard to be a teaching hospital, either you are private or Ministry of Health or Ministry of Defense or whatever, is based on this standard, like what, I'm talking about. I should refer, as long, I'm talking about the Ministry of Education, I should refer at the academic medical system, I should refer that our colleagues, Dr. Khalid Al-Jalban, and under the direction of Dr. Suderi, the vice or the deputy minister for university and innovation, and Dr. Al-Adib, they said, okay, define for us, what do you mean by academic medical system or نظام التعليم الصحي. Dr. Al-Jalban, and he is, was working with King Khalid, he's interested in education also. He defined it, as you can see it in Arabic, but more or less is the same. And they put it in layering that include, level 1, level 2, level 3, and they put them, next slide, and they put them more or less as what we have it and what they call it SHA standard. SHA standard is system health account, which, put, what type of services need to be created and what's the expected cost of it. So if we are going to serve those peoples with such product from our medical education, we need to know how we are going to serve them. All of us, as Professor Hamdi said, we are either the patient or the doctors or the student. All of us, we look for humanism. And being a human or a human being, we have our spirit, we have our psyche, we have our mind, we have our soma or body. And to humanize this system, we need to have the ecosystem, and deeply inside is the medical school or health professional school that Dr. Hamdi already discussed it, so I don't need really to go a little bit further. And this is the humanizing our system is the things that we need to put in our mind when we are going to produce. And the second things we need to keep in our system is the generation that is, going to be taught, not this year, but might be the 10 years from today. This, generation, they have different needs and they have different talent and they have different capability of using, the technology. I'm trying just to, next please. I'm trying just to summarize some of those, things related, to the human being. As a human being, either doctors or whatever are they, and what's the other surrounding or the ecosystem and the other side, and what types of things need to be included in our education. These things, back again to what Dr. Nu'man said, medical education is an art and a science. I will add, for that, it's a philosophy and it's a technology. So the philosophy, the arts and the science and the technology, they are intercorrelated and they are working together either in reality or virtually to produce a good human being with a spirit, psyche, and mind, and so on. The new generations or the generation we have different, needs and have different, ambition. And they are having nowadays, we have the generation Y, generation Z, and we have the generation Alpha. And just to tell you the technology only, that, the generation Y, they were, I would interested, this was 2001 when I was, medical school. Then after that, when I finished the medical school, the generation Z came and they were just using the Nokia phone. And nowadays they are using the smartphone. And when you are in your clinic or around, you didn't need really just to think they can go to the Ambas or up to date or whatever. And they give you, the everything's within, just flex زي ما الهدهد لسليمان just flickering his eye. And this is need to be kept in our mind because most of us looking, either the millennial generation or it might be an older more than that. And also when we talk about the future, either in the health system or medical education or health professional, we need to look, that a human being, next please, the human being is the yellow line, human being knowledge. This is human being knowledge is either a foundation knowledge or a practical knowledge or artistic knowledge, or it can be generalized knowledge. The generalized knowledge is coming from the cultures and some of the philosophical culture and some of the spiritual background. When we talk about the artistic, it's coming from most of it from the psyche and from al-fu'ad wal-wujdan and attitudes. When we come to the practical knowing, it's either manual skills or intellectual skill. Then where the foundation, it's coming, from all these things. So we need to keep it with us whenever we are thinking about the different learning theories and that were discussed next slide, when they discuss it in different, very big numbers, including the behaviorism, the cognition, the constructive, etc., etc. But one of the leading, or two leading or three leading theories that is coming in the past is, Howard Gardner theories, which is, called, multiple intelligence. And this is the one which are using, especially in assessment. And also, when we talk about the degree of the breast that, Alberto Ferreri were discussing during, his presentation in Brazil, then in other countries. And when we talk about the transformative theories, Dr. Hamdi is talking about, is trying to convert, our knowledge to experience and becoming more practical to our life by practice. But need not to forget that there is a new also approach about what we call it adult learning theories and education, and this will be indirectly affect our healthcare system or our health system, including the andragogy, which is mainly an informative, and also we need to have not to forget the transformative theories or learning, which is the things Dr. Hamdi is talking about. And if I'm going to add anything here, I think I need to add the meta formative learning theories based on the metacognitive theories also. So we need to go beyond that, where the technology will utilize, can be used and utilized as a part of learning process. Also, this is part will bring me to the modern, what we call the modern workplace learning theories. And this, workplace learning theory is an important because it put all the things that I talk about, which is they call it the 7 B's, which including the what to provide through the pulls and push, and what to promote through peers and personal, and what to perform through the outcome that I'm going to have. And this is part of the meta-formative learning process that I'm asking, to think about it and to consider it if we are looking for a better outcome of our graduate, and especially some of our people, they are taught here and they can be just pulled to outside. So just to summarize, that the technology transformation and health workforce education should be looked again and again, because it's not only what curriculum are going to provide and how do we select the student or what the environment, and it's more than that. It's have different dimension, and we need to consider the last events that also Dr. Hamdi put it in the second slide, is the COVID. We expect that there will be a lot of syndromes coming after COVID. At least we are, as a physician or as a nephrologist, we've seen, some of the renal diseases. The cardiologists have seen some of the cardiac diseases. People, saw some of hemophilia diseases. So we need also to think about it, not to forget, post-vaccine is changing, and there will be, a new response of our body toward, the vaccine. So these are another factor that we need to not to forget. And who's going to produce our graduate or our workforce? It's the faculty of the university, and you need to be either in the academic or on the Ministry of Health or whatever area, and we need to consider how to build up their capability, including looking for the next piece, the technology, the rules of the generation, and the rules of the especially generation alpha that is coming fast. The technology, we need not to forget the things that mentioned before, such as artificial intelligence, big data, Internet of Things, data science, and machine learning. What is my recommendation for the coming at least several years? I think really, if I'm going to think about the coming several years, I need really to adapt a new approach of teaching and healthcare delivery system. And if I'm going to have healthcare delivery system I should change my medical education and health professional education. Today, I have an extra surplus of medical lab technologists because our machine is becoming automated. Any automated lab can do with one human being all types of labs. I need to emphasize the humanization and standardization, and to have an international accrediting body like WFME for any teaching medical schools or other for like nursing, and develop professionalization and professionalism at the status of post-COVID syndrome. The take-home message that I'd like really to
can you, Professor Fahad, can we wait for the take-home message to be after the question, if you don't mind?
Okay.
Okay. Well, thank you so much, Dr. Fahad, because we have a question from the audience, and they are insisting, for this question. If you allow me, Dr. Fahad, Professor Fahad Al-Muhanna, we're going to start the question and answer, and I would like to also to our audience, if there is any question and answer, you can have it in Q&A, or you can have it in the chat. It's up to you. But I received lots of questions so far for Professor Hamdi and Professor Fahad Al-Muhanna. Professor Hussam, one of the audience asking this question: how do we assess the learning outcomes of medical programs that are administered through either online or remote or hybrid modes during COVID-19? What kind of adaptation are needed?
Well, I don't think this was, during the COVID, it was an era. But now we are going back to the normal life. But in assessment, it's easy to assess the knowledge or the application of knowledge. What is not easy is how to integrate everything together, because competencies, they are not separated entities. Like you don't evaluate knowledge, that's what we do, but it's not good practice. We assess knowledge separately using some instruments. We assess skills using OSCE or whatever. We pretend sometimes that we are assessing attitudes, but I'm not sure if we are doing it in the proper way or not. But actually, in the behavior of a physician or in the behavior of students, all these are integrated together. And that's why we need the assessment. We have developed something called readiness for practice exam, where you are assessing everything, even working with nurses, even writing and taking consents, working with seniors and with other health providers. How to assess this, because this is as close as possible to the workplace. During COVID and when we were away, we have developed a system based on artificial intelligence to have this interactivity between the simulator and the students. And there is a paper which came out in 21, which perhaps you can read it. But the fragmentation, our main problem that we are fragmenting when we come and measure things. And the direction now is that you don't build everything on the final exams or end of phase exams, and then you must have multiple points of assessment, qualitative and quantitative. We ignore the qualitative assessment. While qualitative assessment, they are richest in information and in values and decision making than the numerical quantitative. So we need to mix between both. This is a very hot area, and I invite you to the conference in February, inshallah, it will be discussed.
Sure. Thank you so much, Professor Hussam. Professor Fahad, there is a 3-4 question here about, in your point of view, what are the challenging facing medical colleges preparing with the virtual surrounding, i.e. simulation labs, ERT, etc., for medical education?
I think, one of the most important is the readiness of the ground and the administration of the university to adapt such types of approach. Some of those areas or some of those universities, it's not only in Saudi Arabia or Kuwait or other GCC countries, all over the world. Some of them, they reject, especially the old generation, that they will go to the simulation. Even, the dental college, they were a little bit ahead to, considering medical school. Even, the nursing college, they were a little bit ahead in using, the simulation, the lab, the mannequins, the virtual patient compared to us. It's the problems of the readiness of the ecosystem that we are having, like university administration, and the need of a good amount of budget to develop a really good, skill lab. Simulation lab is not a simple, it's not, cheap. It's one of the most important. When we looked, with Dr. Qayyum during the COVID, as being, an advisor in Ministry of Education, we communicate with him to develop cyber patient lab for all the university, as what we are having in the digital library. It was very expensive, and we need a special budget for that so that we can carry it easily, and we can and we need to develop also the expertise. Lab simulation is not only technician. It needs to be all the staff, including the teacher, to be prepared to carry such things. And people who's now trying to develop new labs, they know how much does it affect. Dr. Hamdi, he was leading the simulation lab in GCC country when he was in Gulf University, and they were doing an excellent there. We just get it from him to our university, and I think our peoples nowadays, they developed a good simulation. King Abdul Aziz, they have an excellent simulation lab for that. We are looking really that we built or to have one of our buildings in our university to be independent simulation lab for undergraduate, postgraduate, and even for the general public. And this is, need a lot of budget, a lot of cost. Thank you.
Thank you, Professor Fahad Al-Muhanna. There is a question to Professor Hussam Hamdi, and I think you are really engaged internationally. And one of the audience asking, what kind of reforms are needed in health professions education in managing the present and the future COVID pandemic if occurs?
Well, again, COVID has disrupted many things. When I came during, after the COVID, or not just before the COVID, during the COVID, and while still the teaching was taking place online and so on, and the program was going on. But if you look at all the programs before the COVID, or even when we started the COVID, there is nothing or very little about COVID. And that's why we stopped here at Gulf Medical University, all the teaching, all the program in all the colleges for 1 week. And we developed what is called the COVID Sciences Week. From immunology to, as Dr. Fahad has shown in one of his slides, the neurologists, the renal, the physiology, the pharmacology, the psychology, the nursing, the physiotherapy, everything, and we call it the COVID science because this is very important. So I think something like that has to be built in now or added to all what we teach in medical schools, including the economics and the finance related to vaccination and related to the COVID. So it's an amazing opportunity to touch around a big theme like the COVID and making changes.
Thank you, Professor Hussam.
Dr. Ahmed.
Yes.
If you allow me just, to have an important comment.
Sure.
Because, I encountered two disasters. I was, during the Gulf crisis disasters, and I was, with the COVID crisis disasters. And in both, I contribute, as one of the people who's working with seniors to me. And also during my working with the Ministry of Health, also I encountered some of small disaster during Hajj. I think one of the most important to have a disaster plan, not at the level of the hospital as the quality people is looking for, it should be at the levels of healthcare system or health system. And this need to be prepared and to be ready. Preparedness and readiness of the system is the things which give me the outcome. If we just review, and that I was reviewing the system, the healthcare system in different countries, we make some review, we look for the preparedness and readiness and their response and the outcome. We found those people who's prepared and ready, prepared by equipment and ready by human being and disposable and consumable, they go through that experience easily. We need to teach our students in our medical schools and other disaster medicine. We were not teaching them emergency medicine. Nowadays, we are teaching them emergency medicine. We need to teach them, disaster medicine, and for us, at least in Saudi Arabia, crisis medicine, because these are an area which is part of the most important of the acute care and critical care. We are taking most of our time is the acute care and chronic care. These are only making 10% of the needed for our students, and we spend 90% of our teaching. Thank you.
Well, there is a question. Really, that's a futuristic question. One of the audience, he asked. He said, "I wish to Dr. Fahad answer about or give us some suggestion for building healthcare system model to fit for Saudi Arabia to realize the vision of 2030 and after pandemic." What you can say for this question, Professor Fahad?
It will be very difficult, and it's not the time really to discuss it. The gentleman, if he knows me personally, he can come and I can show him what I wrote.
Okay. Well, thank you so much, Professor Hussam Hamdi, Professor Fahad Al-Muhanna. Within this format, usually we have a final thoughts. This final thoughts, we usually tweet it all over the world. This is from our expert. Definitely with this very rich experience and very rich chat and talk from Professor Hussam, he has something to summarize or to give us his wisdom in it. Professor Hussam?
Yes. I think, as is written here, that with medicine becoming increasingly high-tech, training on compassionate, humanistic medicine becomes essential. And definitely, machine will not replace human, but they will enable them. Thank you.
Well, thank you. Let's tweet this one from the Professor Hussam Hamdi, and I think this is a piece of wisdom. Let's see the Professor Fahad Al-Muhanna. He has also tweet for final thoughts. Professor Fahad?
I think really we need to reinvent our philosophies, art and science of medical education and health professional education based on a closed loop educational system. And this is, looking for our future of medical education and health professional education, and it should be aligned with the need, economy, and the new changes within the globe, especially after COVID. Also, we need to revitalize our academic medical system by reviewing, our status of education, research, and healthcare to be in accordance with the new changes after COVID-19. Thank you.
Thank you so much, Professor Hussam Hamdi. Thank you so much, Professor Fahad Al-Muhanna from Saudi Arabia, from Imam Abdurrahman bin Faisal University. I would like to extend my thanks to the audience. They've really been with us from all over the world. This webinar, we would like to thank these people from Canada attended as well, and Ghana, and also South Africa. Thank you so much for everyone. Really, it's an honor for us and Imam Abdurrahman bin Faisal to run this international webinar, and we find people next to it. I just want to say one word from Dr. Hussam for you, and one word from Professor Fahad Al-Muhanna for you. Professor Hussam.
Well, one word, I would like perhaps to share one slide. Where is my slide?
Okay.
Slide, please. Yes, I think perhaps this is something to share it as for a closure. Again, that we need to revisit the metrics of measuring quality in health professional education, the big picture. And I invite you all to this international conference, which will be in February, inshallah, where the accreditation bodies with the academician, the researcher, the healthcare providers will be together looking into how we measure quality and assessment of students related to the quality of all our programs. So hope to see you soon, inshallah.
That's invitation from Professor Hussam Hamdi for all of you. Please welcome to Dubai to attend this webinar, this international conference. Professor Fahad Al-Muhanna, before we close.
Thank you for everybody. Thank you, Professor Hamdi, for your invitation.
Well, last slide here. I would like to thank all of you. See you in our next webinar. Will be November 11 with a new, with other colleagues, experts. To view our webinar, please visit our YouTube channel. You're going to have it ready, or our social media as well. Tomorrow, you're going to have the tweets as well for our expert. Many thanks for all of you, and nastawdi'ukum Allah. Thank you so much.
Thank you.
Assalam.
Assalam.